the medication administered was done by qualified staff and to a level that was safe and good. Unluckily, it can involve that the relatives try to administer or help with the administration of medication, which of course is not good and not safe. So although you would try to get a good level of understanding with all the relatives, this is far from a good practice.
I did go to a care home with nursing where most of the service users ate at tables. The tables were beautifully done, very nicely done, with napkins, serviettes, menus. But one or two I noticed of the service users didn't want to eat in this way. They wanted to eat alone. They felt that they perhaps made noises while they ate, or they were messy, and they preferred to eat alone. And they usually tried to express this. I was impressed by the way that the staff made room for them to eat alone, but kept a discreet eye on how they were eating to make sure that they were safe while they were doing so. The service users certainly had the impression that they were eating alone, but they were actually being supervised, and I was quite impressed by that.
The good thing about the inspection I did was that the caring level was very personalised. This means to say that everyone knew their users to the point of if they wanted to be a different name, if they wanted to be addressed differently, if they knew they could be slightly more, shall we say, tactile, in anything like that. And also eye contact. If you were a wheelchair user or something like that, you administered your care and addressed them in the way that they found that was good for them.
They would also be seated amongst their friends rather than sitting all around one room. So it was a really good experience, and I felt that was a good example of safe in a home. Good caring in the home is where caring staff are speaking on first name terms with residents. And residents are obviously understanding the staff as well.
They feel like they've been respected. You know, it's always nice to have that feeling of like you're being listened to, and you know you've been taken into consideration, and that generally just people just do care about you.
I've been to one or two homes where they often have service users who want to use a different name to that given on their file. And this is usually embraced, and I think should be embraced. And in the best homes, that is the name that all the staff use. It's written on the door to their room, if that's appropriate, and the staff know who they're referring to when they use that name. I went to one care home where they had two dedicated staff, both responsible for the activities that the service users were able to take part in. They were very good. They did individual activities with various service users and group activities, and they also had community activities where they were bringing different aspects of the community into the home to interact with the service users. That was the best example of an activity programme that I'd actually seen. The whole system amalgamates together to make a full round circle, and that then makes a full round system. You know how to complain, you know how to get the answers you need, where you need to go and get those answers, and those answers are well responded to, they're considered, and the situation is effective, and that's the most important thing.
The team were working as one team. They were not working as sitting back saying, what do I do now? They were working as a team, all knowing their roles and being very supportive for the service users.
You have to cater for everyone's needs, so you have to have maybe different ways of signage, communication, whether they may need things in large print, whether they may need things in symbolisation, whether they need pictures, drawings, or maybe being helped to picture and drawing back to you. whatever that communication is, you'll find that that is a good, responsive care.
The management of the home are well known to the residents, and the residents feel comfortable in raising issues to the management of the home. So the issues that come up on a day-to-day basis, the residents don't feel frightened to go and talk to the manager. The manager is available all the time and can actually deal with any kind of problems that come around.
Well, I definitely think that people who use services will benefit from cooking on their own, and being able to be able to do that task on their own. If they need support, that's fine, but it's a good thing to have under your belt prior to leaving, so you've got those skills when you're out there in the future.
Sometimes the residential home needs to be very proactive when looking at a service user's medical needs. It may be that the poor service user cannot actually express for themselves that their foot is hurting or they have a sore toe or something like that, so it needs to be picked up during their personal care and actually referred on, and to actually get somebody to have a proper look at it. If the service user can't actually talk about it, this can be very difficult, and I have seen that happen. I had a lady who was gesturing at one point that she had a sore foot, but it hadn't been picked up straight away. But when we talked about it, they were on the ball and very willing to refer on.
The NHS is a very complicated, very layered system. The most important thing is who is in charge, and your direct person that you can always come to and feel that you confidently get a result.
One example is the care home I visited, where the management of the home had been in situ for a long period of time, and it gave a nice stable staff and a nice stable care team. And the team were working as one team. They were not working as sitting back saying, what do I do now? They were working as a team, all knowing their roles and being very supportive for the service users.
I classified one home as really good for being well led when both the relatives and the service users had regular, quite informal meetings to be able to bring their views, whatever they were, to the managers and staff. And these meetings happened regularly. They weren't cancelled, they were prioritised and given some importance.
Staff have to be able to have the right training and be knowledgeable of their work and what they do. Also, it's important that there needs to be enough staff on the wards so that things can run smoothly. Anybody experiencing mental health problems, you can be down but never stay down.
Seeing a team working in unison, supporting residents and helping them is good.